Good morning, everyone. Welcome to Cochlear Southeast Asia's live chat session. My name is Renato, and I'll be your host for this morning. So this series of live chat came about as we aim to raise more hearing health awareness and to also offer information for people out there who are looking for solutions for their hearing loss. Since this is a live chat, we encourage everyone to type in your comments and your questions in the chat box, and we'll try our best to answer them at the end of the during the session. Okay? Please also be reminded that we are having a lucky draw. So we're giving away one Bluetooth speaker that also functions as a night lamp to one lucky winner. So for those of you who haven't registered, you can register via the link which you can see below. And at the end of the session, we will be announcing our lucky winner. Now, before we start, we would like to share a video of one of our cochlear recipients, Mr. Chu. This video was taken about 4 years ago. And, back then, Mr. Chu had hearing loss and had been wearing hearing aids. When his hearing dropped and hearing aids were no longer enough, he took it upon himself to find out what can be the next step. This is when he sought help from the Ng Teng Fong team, and that's when he was advised a cochlear implant. So let's go back and watch his journey by playing this video. Wow, such a nice video of Mr. Chu. So as you can see, when things aren't working, all it takes is to really take the first step and try to find out where you can find help. By consulting with a healthcare professional, he was advised a more appropriate solution and is now living actively and independently. Now, speaking of healthcare professionals, I'm very excited to introduce our team from Ng Teng Fong General Hospital, who will be sharing with us about their expertise on this topic. So we have our ENT consultant, Dr. Jiaying, and two senior audiologists, Hui Ting and Shermaine. So thank you very much for joining us for today's session. Yeah. So let's get started. To Dr. Jiaying, I'm sure our audience are curious to know after watching Mr. Chu's video, what are the common signs that we should look out for to know if we have hearing loss or not? Oh, you're on mute, doctor? Just unmute. Oh, Dr. Chiang, I think you're still on mute.
Sure,
Okay.
I apologize for that. Yes, Mr. Chu, he's my patient. He's an exceptional poster boy for active aging. He is really one of a kind, and I feel that he really is a testimony that he is living a long life as well as he's living a good quality of life. Yeah, back to your question, Renato. I digress. Yeah, there are some signs to look out for if you have hearing loss. I think patients themselves will realize that when people speak to them, the quality of the speech is not so clear. So what they hear is actually muffling of speech. They can hear something, but it doesn't make sense. The quality of the words are degraded. They also start experiencing difficulty in hearing words in a noisy background, say in the food court, in the market, or say in the shopping center. They are also frequently asking others to speak slowly, clearly, and louder so that they can actually catch the words. They also notice that they have to turn up the volume of the television at home louder, as well as the radio at home or in the car becomes louder and louder. Their family members will also be able to notice subtle changes. So, for example, if your family member is not being able to take part in family conversations at the dinner table, for example, as readily as before, they start to become more withdrawn. You ask them questions, they don't quite answer it appropriately, or they try to divert the question to something else. That's a telltale sign. Or they start to avoid certain social settings. They're not so keen to go out and participate in family activities or something which has to require them to listen and respond appropriately. There are also other things such as inattention to daily sounds. Like, for example, the doorbell may be ringing and then your family member may not be able to hear it, or the telephone is ringing and they can't hear it as well.
I see. Yeah, very interesting. From the common signs that you shared, it seems like hearing doesn't just affect the individual, but also their family members as well. Um, I'm also wondering, are there factors that predisposes me to hearing loss?
Oh, certainly. Um, Aging, unfortunately, is one of the biggest factors of hearing loss. We all know that as we age, there's some degree of hearing loss because the nerves start to degenerate due to old age and the different factors. In fact, 50% of people aged 65 and above experience some degree of hearing loss. But the severity of the hearing loss varies from individual to individual due to genetics. Say if you have a family history of early hearing loss in your family members, say your father, your mother, aunts and uncles, you tend to get hearing loss around the same age as when they started experiencing their hearing loss. So that part is genetic. There are other things such as chronic loud noise exposure, which predispose people to hearing loss a bit earlier. So certain occupations, like say if you are in shipyard work and you hear drilling or welding sounds, or say in the aviation industry where you actually come to contact with loud the aeroplane machines. These are occupations which are in contact with hearing loss day in, day out, and over time it affects your nerves and causes hearing loss earlier. Some noise-related recreation can also cause hearing loss. Say if you're a drummer in a band or you play in a rock band regularly, you do get some degree of hearing loss as well. You do also realize that musicians, these rock band musicians, they all have some degree of hearing loss after many years. Patients with recurrent ear infections also put them at risk of hearing loss because they might have perforated their eardrums and resulting in recurrent infections, and their middle ears may not be as healthy as before. The bones in the middle ears may be eroded over time, and this gives you hearing loss. Certain medications like chemotherapy drugs or very strong antibiotics, which some people might need for prolonged periods of time, predisposed to hearing loss. And certainly certain illnesses like meningitis, which is a very life-threatening infection of the brain lining called the meninges, or any brain infection can actually cause severe hearing loss. People with previous radiotherapy are also at risk of hearing loss.
So if aging is one main factor, that means we really need to keep monitoring our hearing, especially when we reach our senior years. Yeah, very
Yes.
interesting. So for our audience who may be wondering, when should they see a doctor for their hearing loss?
Um, there is a medical emergency which the ENTs call sudden hearing loss. If you have a sudden hearing loss in 1 year, this is considered a medical emergency, and you need to see the doctor immediately. This is a separate entity from aging hearing loss, which I'll talk about later. Sudden hearing loss needs to be seen immediately because the treatment and the management is time sensitive. So if you do experience hearing loss in just 1 year, please go see the doctor immediately. Now, hearing loss related to aging is a different story altogether. It's usually gradual and over, say, a few years. And the patient, himself or herself, may find that it's starting to interfere with their daily life. And if that happens, just talk to your family doctor or your polyclinic doctor. Tell them, I think I can't hear so well in the past few years. Do you think I can get it assessed? And they will very easily refer you to an ENT doctor like myself to have a comprehensive ear assessment. Actually, you'll be surprised that oftentimes the push factor for elderly patients to come seek help is grandchildren. And when they find that they want to be part of their grandchildren's lives, they want to watch them grow up, that's when they start to seek help. And COVID has been a great innovator as well, because it has pushed patients to actually seek help when there's a lot of mask wearing. And it used to be when we didn't have to wear masks, you could actually read people's lips, read their faces, look for non-verbal cues. But now with mask wearing, a lot of people have been tipped over and they can't hear as well as before because others are not pronouncing and speaking, articulating loud enough, and they can't read non-verbal cues. So that's when they have started to seek help for their hearing loss. Now, if you do come and see me in the ENT department, I usually check your ear for any earwax, any infections, any structural causes which can cause hearing loss. Then this is followed by a quick hearing test, which can be done in the same day, in the same clinic as me, and it can be quickly done. So what is done is that we get an audiogram result. Now, the audiogram is essential because it tells me what kind of hearing loss you have. It can be either be a conductive hearing loss, which means that the problem lies with the outer ear, or the middle ear, which is the space behind the eardrum, or it can be sensory neural hearing loss, which is in the cochlea or in the inner ear. So it can also be mixed, which means it's a combination of both conductive and sensory neural hearing loss. Now, what I'll show you next is the audiogram, what an audiogram looks like. It's actually a squiggly line of two squiggly lines for right and left ear. But what it tells me is a lot of information. It tells me whether you have normal hearing, or if you do have hearing loss, is it mild, moderate, or severe hearing loss? And we assess 2 years at the same time. So the diagram on the right shows the final audiogram result. And in this patient, you can see the hearing is not great. There's actually a sloping loss in the high frequencies.
I see. So yes, you heard it here. If you have sudden hearing loss, treat it as an emergency, and you really need to seek help from your specialist. If you're unsure, then you can still go to your family doctor, and they would know where to direct you. So another question, Dr. Tsiaing, what do you think are the reasons which stop people from seeking treatment early? And I guess I want to ask Hui Ting also if you see the similar pattern.
Yes, they are. It is very interesting. After seeing so many patients with hearing loss, I have noticed a kind of pattern. So I would say that the first reason why people don't want to seek treatment for hearing loss is they're worried. They're worried about being socially stigmatized as having a handicap with their hearing loss. So they often downplay their symptoms. They'll tell their family members, I still can hear you. You just have to speak louder, speak slower, and speak clearer. You are mumbling. Or then they will think to themselves, this is part of aging. I'm old already. This happens to old people, so I'll just accept it because I'm growing old. They may not also want to be the first in their group of elderly friends to say that, I'm actually wearing hearing aids. It's actually a social thing, but actually there's nothing wrong with it. You are when you wear hearing aids, you actually become functionally back to normal. And that is great. It's better to be able to hear better and communicate. I mean, having good hearing is the first step to good communication, and that's very important. Now, I think secondly, a lot of the elderly patients don't work nowadays, and they actually reliant on their children for, say, some form of assistance for daily living. So they're worried of becoming a financial burden to their children because they might have to see a doctor and eventually might have to buy hearing aids for both ears, and they're worried about the cost of the hearing aids. Now, not to worry, everyone. We'll advise you later on in the talk about what avenues of government funding there are for hearing aids. And lastly, this one's really funny. A lot of the patients receive well-meaning misinformation from their families, members, extended family members, friends or relatives. They will start like this. You know, my brother's friend, sister-in-law tried hearing aids for hearing loss, and I tell you, they were lousy. They were so lousy until she gave up on it and she just threw it away. They just don't work lah. So that is a very common thing I hear. And then it reinforces their conviction that hearing aids are a waste of money. Even though they have paid for it, it doesn't work. And so nothing can actually be done to help overcome hearing loss. It's just a part and process of aging, and they are resigned to just living with it. Yeah, so that's what I find. Ying, what do you find on your side?
Yes. So like what Dr. Jai has mentioned, we commonly hear patients telling us that they can still hear well sometimes, or they do not see the need to actually improve their hearing as they are not working. So other reasons for not seeking treatment include hearing from others that or from relatives or friends that hearing aids are very noisy, and they are troublesome to actually manage and maintain, as well as financial concerns. But since actually we're at this topic, maybe I'll take this opportunity to clarify some common misperception. First, on the part that hearing aids are noisy, the purpose of a hearing device is actually to allow someone with hearing loss to hear better by amplifying sounds that they are missing out. Age-related hearing loss is gradual, and it is common for individuals to have hearing loss for many years without ever realizing it. Imagine not hearing or hearing certain sounds softer for many years. After putting the hearing devices, it may come as a shock to many, as they can now hear more environmental sounds as they previously missed out without any hearing device. So for example, hearing their own footsteps or even hearing their own voices. So the usual advice that I give to patients is that we can start off by fitting hearing devices at a more comfortable level. But for the best outcome, we need you to wear them consistently before we can make it clearer. Wearing the devices regularly at all waking hours also allows your brain to adapt, and this adaptation process can take a few months. Next, with the advancement of technology, it is also easier to maintain and manage the hearing now as compared to the past. For example, there are models now which allows user to actually charge and dry hearing aids at the same time. So in all, what I want to convey is that take the first step to at least try out hearing aids, because it may not be as bad as you think.
Thanks for sharing, Hui-Ting. I think it's important what you mentioned about, that it takes time to adjust to the sound of a hearing aid. So it's not like wearing a pair of specs and everything is clear right away. So I guess that's why it's important to, work with your audiologist so that they can adjust it for you. How about for Charmaine? Can you share with us what are the tips that you usually give, that you can give to our audience to convince them or their family members how they can, to get their hearing checked?
Yep, thanks, Renato. Yeah, so untreated hearing loss can have significant effects on individual social well-being and emotional health. When you have hearing loss, you have trouble following conversations in a group setting, for example, in meetings at your workplace or during family gatherings. So due to this problem, individuals with untreated hearing loss may actually experience frustrations or embarrassments for hearing conversations wrongly or missing out on important information shared. Over time, they tend to socially withdraw themselves from visits with friends and their loved ones due to fear of making others repeat or, just agitating them. So this can also lead to social isolation, low self-esteem, depression, and anxiety. Another thing to note is that it's important to have your hearing checked to maintain independence and for your own personal safety. So maybe I can share a story is that I have a patient with severe hearing loss in both ears. I remembered seeing him together with his wife during the first appointment. He was extremely quiet during the session, and every question posed to him, he would turn towards his wife and wait for her to answer on behalf of him. So his wife shared that due to his poor hearing, she had to take, leave from her work and accompany him for all his medical appointments, as he was unable to hear his doctors. But after being fitted with hearing aids, not only was the patient able to attend medical appointments on his own now, he's also a much more cheerful person. Like he loves to share, many life stories with me during the appointment. So as for safety, imagine yourself commuting about and being unable to hear environmental sounds, notifications from the public address systems, or even vehicle horns. Yeah, so it's not only dangerous for you, but it also worries your family members whenever you are moving about on your own. Last but not least, another consequence would be that apart from social and emotional well-being and safety, untreated hearing loss can also affect your overall cognitive health and speech understanding.
Okay. So again, some tips for the audience. If you frequently find yourself getting frustrated, withdrawing socially, so I think that's why it's important to act now and get your hearing checked. Now, for Dr. Tsai, lately there has been some buzz about hearing loss and how it can be linked to dementia. Can you share more about this topic?
Yes, certainly, Renato. I think the question is why now there's so much buzz, right? That's because previously I think ENTs were just ENT surgeons were concerned with hearing loss alone. We're largely surgeons and we're very siloed. Then there was also dementia, which was a totally different thing. It was more of the medical realm. But now people are trying to link two together. How does hearing loss affect the brain? And that is when they had done longitudinal studies and they realized that, that actually hearing loss actually can cause dementia. And how it does it is in three ways. Number one is if you think of your brain as an overall thing, there's a hearing section of your brain. So if you have hearing loss over time, this part of the hearing section of your brain becomes inactive. And when it becomes inactive, there are changes in the structure of the brain and there is tissue loss. Now, think of it over long term, if there is continued tissue loss, it results in further brain shrinkage. And MRI studies of patients with hearing loss versus brain volume of patients with normal hearing have shown that patients with hearing loss have a smaller size or what we call brain atrophy compared to patients with normal hearing. So secondly, it's also hearing loss causes a brain overload. What I mean is that when you can't hear, the brain must work overtime to make sense of what people are trying to say. You're trying to make sense of some degraded signal, trying to understand and trying to communicate with such a degraded signal. So if you strain all day, every day, it depletes your brain of mental energy and steals your brain power for other crucial functions like thinking, remembering, and processing. So as a result, of this work of overhearing, the brain's ability to channel its energy to other essential functions actually gets depleted. And that sets the stage for dementia and other cognitive disorders. Lastly, hearing loss actually causes some degree of social isolation. Actually, in America, the National Council of Aging studied 2,300 hearing impaired adults over time, and they found that people with hearing loss and didn't do anything about it were actually more lonely. They felt more lonely. They were very worried about their health. They were more anxious and paranoid because they were worried about bad things happening to them. So as a result, these people tended to stay at home. They didn't go out. And when you don't get interaction with people, you don't get interaction with places and things, the less stimulation your brain gets and the faster it would decline. So putting you at greater risk for dementia.
That's very interesting, Dr. Tsai. I didn't know that our brain can actually shrink. And what you mentioned about brain overload, it's fascinating how the brain needs to work harder which may set the stage for early cognitive disorders. How would you determine if the patient that you are seeing is showing signs of dementia?
Yes, this one's a hard one because it happens on many levels, and a lot of it is actually family members and maybe the patient themselves being aware of small things. But the most typical symptom is actually forgetfulness. The forgetfulness is, yes, you would tell me, yes, I do forget my things once in a while. You would forget, like, where did I put my car keys in the house? But it's not that kind of forgetfulness. It is more of, do I even own a car? It's not about where you put your car keys. It's about, do I own a car? It's something more severe than that. So when people start forgetting information they used to remember quite readily, or information you should know, that's a very worrying sign. Other things are like problem solving. They may have difficulty solving simple problems which they used to have no problems with, or finding the right word to say in a sentence. Or worse still, trouble finding their way around a neighborhood which they have lived for more than 10 years. So that is all red flags. And if you or your family members notice any of these red flags, do let your hearing professionals or your ENT doctor know, so we can actually refer you to the appropriate professionals for a comprehensive dementia assessment. Actually, people over the age of 60, 36% of their dementia risk is actually associated with hearing loss.
Okay, I'm glad you clarified, doctor, because I myself can be forgetful at times. So that's good. Yeah. But another question is: does having hearing loss mean that I will get dementia?
No. I would like to clarify that no, it doesn't mean that everyone who gets hearing loss will definitely get dementia. Dementia is just too complex a syndrome. There are many factors causing it. There's genetics, there's some degree of environmental factors. There are a lot of factors which we may not even know yet because research is still ongoing. But we do know from the studies that hearing loss does increase your risk of dementia. And the severity of the hearing loss is correlated to the dementia risk. Now, if you have a mild hearing loss, your risk of dementia is twice that of someone with normal hearing. If you have moderate hearing loss, the dementia risk is 3 times. And if you have severe to profound hearing loss, the dementia risk is as high as 5 times. So as a rule of thumb, we think that every 10 decibel worsening in hearing loss from baseline actually increases your dementia risk by about 20%.
Okay, I'm sure our audience is a bit relieved hearing that not everyone with hearing loss will get dementia. But it's good you highlighted that there are some red flags that we should look out for. And it's important why to get our hearing treated. How about for Charmaine? In that case, will treating hearing loss reverse dementia?
Yep, thanks, Renato. So maybe to add on to what Dr. Tiang shared about earlier about hearing loss and dementia, it has been reported by the Lancet Commission that 40% of dementia cases can be prevented or delayed by targeting 12 modifiable risk factors throughout our life, one of which is correcting hearing loss. So untreated hearing loss also results in social isolation, which is a risk factor for dementia. But do take note of these stats. These stats are only applicable before the onset of dementia. So as for whether or not treating hearing loss can help reverse dementia, that's a good question. So what if someone has been medically diagnosed with dementia? Will correcting hearing loss treat or slow down cognitive decline? In the clinic, we sometimes do see next of kin bringing their family members with dementia for hearing aid trial. The common thought is that the act of wearing hearing aids can treat dementia or slow down cognitive decline. So while early data on the effect of hearing aid amplification on cognition seems promising, but we need to highlight to the audience that more large-scale randomized controlled research still needs to be done to determine if treating hearing loss slows down the rate of cognitive decline. So as mentioned earlier, treating hearing loss is one possibility of prevention or delaying the onset of dementia. However, once an individual has dementia, there is no concrete evidence to show that treating hearing loss improves or slows down the cognitive decline. So as such, our advice is to treat hearing loss early to reduce the risk of developing dementia. But it is important to know that putting on hearing devices alone will not prevent the onset of dementia. So apart from using the hearing device regularly, it is important for individuals with hearing loss to continue communicating and engage in meaningful social activities. Regular interaction with others allow one to maintain good mental health and exercise cognitive skills such as memory and language, which keeps the brain stimulated.
Can I share a story, Renato? I mean,
Sure.
I think we are talking about dementia as an entity, but you don't really know what it feels like until you actually have a story to illustrate it and what it means for your family members. So let me tell you a story about my patient. He's an elderly, about 70-plus-year-old uncle. His wife passed away about 3 years ago, and he was living in the same flat as his two unmarried daughters. They're adults, they're working. So dad has one room, and the two daughters each have a room of their own. So the two daughters are very busy. They go to work every day in the morning quite early, and they come back quite late at night. They know that dad is at home. They see dad in the morning when they leave for work, and then they see dad when they come home at night. He looks okay. He's in his room. That's it. They're like, hi, bye. That's it. But they didn't realize that dad had some degree of hearing loss. He was actually lonely because his wife had passed away, and he was all alone at home by himself. And he was experiencing hearing loss. He wasn't so confident about going out on his own, so he was stuck at home the whole day. And there was not much interaction at home as well, because no one's there to talk to him, and he doesn't dare to go out, and he doesn't have that many friends because he's very socially isolated. Now then, his daughters weren't aware that something was going on with him. They weren't reading small little signs, and on the weekends they were tired, they were resting, they didn't hang out with dad. Then it got quite bad, or rather came to attention of their daughters that something was wrong with their dad, when one day he decided he needed to venture out to get food. And he had a problem coming home, and he was picked up by the police, and one of the daughters was called to say, your dad is here in the police station. Do you think you could come get him? And that was when they realized, oh no, there's something wrong with dad. He was cognitively impaired. Basically, they would ask him a question, and he'll fudge around the answer. He doesn't quite know the answer, but he'll just divert the answer to something else. And part of the reason was he couldn't hear. So the daughters tried to get him a hearing aid, but it was too little, too late. They had missed the boat for making a difference. So they strapped on a pair of hearing aids, but there was mainly more for environmental awareness. They had missed the step to actually make a difference to his cognition. And to make matters worse, his dementia got so bad, he's actually dependent on people to feed him and bathe him. And one of the daughters had to stop working to look after dad full time because he was at risk of harming himself. He was basically unsafe. So she had to stop work to look after him. Very sad, but very real too.
Yeah, sad to hear, but thanks for sharing, Dr. Chiang, to give our audience some perspective also. And I want to go back to what Charmaine also shared, that it's not just about wearing the device, but actually you need to be active and stimulate the brain to keep your brain well exercised. So now that we know that it's important to treat hearing loss early, let's discuss what are the steps that we can all take. So maybe Hui Ting can share, in Singapore, where can I go when I suspect that I have hearing loss?
Okay, so I'll simplify the process as is illustrated by this flow chart. So if you suspect that you or your loved ones may have hearing loss, check with them if there are other symptoms such as ear pain, ear discharge, or dizziness. If so, it is recommended that you actually get them to go to any GP clinic or polyclinic to get referral to the ENT department at any government hospital for further evaluation. If you do not have any other ear-related symptom but require financial assistance, it is also recommended that you take the same route to get a referral to the ENT department at any government hospital. One thing to note is that individuals with CHAS card should make sure to go to CHAS registered GP clinic for referrals. If you do not have any ear-related symptoms and do not require any financial assistance, you have the choice to go to the audiology clinics in the government hospital or any private hearing aid clinics for a hearing assessment. No matter what, it is still advisable to see the ENT to rule out any medical conditions of the ear.
Okay, yeah, thanks for sharing that, Hui Ting. I think that diagram makes it clear for our audience. But I'm sure they're also wondering what happens when they visit the clinic. Who will they meet? Maybe you can share more on this, Charmaine.
Yep, that's right. So when you're at the ENT department, the ENT doctors will first assess you and manage any outer or middle ear conditions, such as earwax or ear infection, before sending you over for a hearing test. So individuals with suspected hearing loss will have to undergo diagnostic hearing testing. The two most common tests that we do in the clinic is the pure tone audiometry test and tympanometry. So for pure tone audiometry, basically patients are required to wear headphones and listen to short tones played at different volumes and pitches into each ear, one ear at a time. This is to determine the softest sound one can hear at different pitch. The duration of the test usually takes approximately 15 minutes or so. So for tympanometry, a soft probe will be placed at the opening of the ear canal to create a seal. You will feel some pressure in your ear for a few seconds only, and this is to measure the function of your middle ear. So after the test, the ENT doctor will review the test results with you and discuss on any medical or surgical treatment options available. Those who do not require any medical interventions and are suitable for hearing devices will be further referred to the audiologist for hearing device evaluation.
Thanks for sharing, Charmaine. It sounds actually simple that we can do everything during one visit. But now that, let's say I get diagnosed, I now know what my hearing loss is. What are the treatment options available, and do they all work effectively?
Okay, so maybe I'll take this question. So there are a few treatment options to choose from for rehabilitation. Hearing aid is usually the first step taken to help individuals with hearing loss hear better. They will have a chance to try out hearing aids in their first appointment with the audiologist. And based on the needs and ear condition, the audiologist will recommend the most appropriate hearing aids and management plan for each individual with hearing loss. But the journey with hearing aids do not end after collecting the hearing aids. Hearing aid users will have to diligently wear their hearing aids for the habituation adaptation to take place. And this process will take longer if they have hearing loss for a long time. It generally takes a few sessions to optimize the hearing aid settings, and the duration for optimization goes according to the pace of an individual's adaptation. The audiologist will also run some tests to assess the outcomes with hearing aids. In cases when the hearing aid users do not benefit much from their hearing aids or their ear conditions are actually aggravated with the use of hearing aids, the audiologist will refer them back to the ENT specialist for further management. I'll let Dr. Jiang cover this management aspect for this group of people who do not benefit from hearing aids.
Sure. So taking off from where Hui Ting was explaining, patients who come to see us actually are part of a journey. We actually look after you from the start when we assess you to when you start having hearing aids. And when the hearing aids don't work, Charmaine and Hui Ting will knock on my door and says, this person not doing so well with hearing aids. Can you have a look and assess? So that's where I come in. And we will assess and see, based on the severity of the hearing loss, the type of hearing loss, and the ear structure, what kind of treatment would be suitable for you. And of course, everyone's treatment is tailor-made to their own needs, their ear structure, as well as their social background. So let me explain to you what are the options available. Let's first talk about cochlear implants. So cochlear implants, traditionally, we tend to associate them with for implanting kits. But actually nowadays, more and more elderly patients are getting cochlear implants to improve their hearing. Then traditional candidacy was for profound hearing loss. That means the rock bottom of the hearing loss patients got cochlear implants. But now with expanding indications, because we know cochlear implants work and they work very well, so they have expanded the indications for severe hearing loss, so that more people will gain benefit from the cochlear implants. And in very select users, there's a hybrid use. What I mean by that is that people with good low frequency hearing, but they have severe to profound high frequency hearing, they can also possibly benefit from a hybrid use of a cochlear implant. I think nothing illustrates it better than, say, a case study of somebody. So let me talk about a patient of mine. We are going to show his journey. So he's actually a 70-year-old male. We use a stock picture because he didn't consent for photography. But anyway, he's a 70-year-old male. He's a retired accountant and he has 2 daughters, very lovely daughters. He lives with the elder daughter who has a family of her own. She has 2 young boys who are in primary school. So the family brought him in for evaluation of his hearing loss in about 2015 because they noticed that they had to repeat themselves many times to be able to communicate with him, and the TV volume was getting louder, and the grandchildren also complained that grandpa couldn't hear them. He was fairly healthy. I mean, as all 70-year-olds, he had a touch of diabetes, a touch of high blood pressure, and a bit of high cholesterol, which is quite common for someone of his age. So let's have a look at his hearing loss audiogram. So the top 2 diagrams are the audiograms in 2015, and the bottom is his progress in 2021. So the top left-hand audiogram actually is a hearing test. Audiogram is a hearing test of a patient with just checking his inherent hearing. So we can see he has severe hearing loss, and we thought, okay, I think he needs hearing aids. So we fitted him with hearing aids on both ears, and the diagram on the right is what we call an aided audiogram, which means when you put on your hearing aids, how well are they working for you? You can see actually that he was doing much better than without hearing aids, which is the diagram on the left. He actually was fairly functional, especially in the lower frequencies. So he was getting by, but gradually, of course, as time went on and as aging thrown into the factor, his hearing started to deteriorate. So if you look at the bottom left audiogram, his inherent hearing thresholds started to drop, and you can see the graph starts to slope downwards, especially at the high frequencies. Now he has reached profound levels at certain frequencies as well. And then we continued to work on his hearing aids. We tuned it. I think we had an upgrade at some point of time. And with the best efforts of a hearing aid, he was still not getting good hearing. So the audiogram on the right is what we call the aided audiogram. When we put his fully optimized hearing aids on, he was still not getting benefit from it. He's actually averaging about severe hearing loss even with the hearing aids. That is when we start talking to you about, what do you want for your hearing? Do you still want to be in the hearing world plugged in with your family? Because the hearing aids have done their job, and I think your hearing loss has outpaced your hearing. Hearing aids have outpaced your hearing loss, and you need to start thinking about the next level, which is what we call surgical implantable devices, and that will be a cochlear implant. Now, for the uninitiated, a cochlear implant looks like this. It has an outer component as well as the inner component. So the surgery implants the inner component, but you also have to wear an outer component. So if you look at the diagram on the left, there is a microphone which picks up the sound, and then it is then the sound signal is then converted to electrical signal at the speech processor, and then this electrical signal follows the wire through the magnet and into the inner implantable portion inside you, and it goes through an electrode right directly into the cochlea, which then sits next to the auditory nerve, and it stimulates your hearing. Let's play the video to show what it actually sounds like. So the sound is picked up by the microphone. It is converted electrical signal, which then very quickly in nanoseconds just reaches the cochlea, and it stimulates the nerve. There are actually two designs available for cochlear implants. There is the behind the ear component, behind the ear option, which is demonstrated with the picture on the left, and there's the off the ear component demonstrated by the picture on the right. Which one for you? It really depends on your choice and your lifestyle. There are some patients who may not need cochlear implants, they need bone conducting implants. This one's a bit different. What it does is that it's actually like a hearing aid, but it's directly implanted into your bone, and it bypasses the need of a eardrum or a middle ear. So say patients with a perforated eardrum who are unable to wear hearing aids because of recurrent infections, they may be suitable for a bone conducting implant. Now, please play the video so they have an idea how it works. So sound is received from the microphone, and then it is then transmitted via bone into the cochlea via bone conduction. So this is suitable for patients with conductive hearing loss, with single-sided severe to profound sensory neural hearing loss, borrowing the cochlear capacity of the normal side, and selected cases of mixed hearing loss. Now, what does it look like? It's actually like this. This is a patient of mine. She's wearing a Baha Attract implant. So it's actually attached to her via a magnet. The magnet strength can be varied according to the patient's needs. Yeah, so that's cochlear implants and bone conducting implants for you.
Thank you for sharing, Dr. Chiang, about the treatment options available. Now, I'm sure some of our audience have encountered this, that sometimes they see hearing aids online. Why can't we just purchase those?
Okay. So I'll take this question. So this is a very interesting topic. So what those hearing aids that you see online are actually hearing amplifiers. So both hearing aids and amplifiers helps to make sounds clearer, but that is actually where their similarity ends. So what are hearing aids? Hearing aids are Class 1 medical device regulated by the US FDA. So these devices are customized and optimized to a person's hearing loss with the guidance by hearing professionals. On the other hand, hearing amplifiers can be purchased over the counter without any prescription. They are not customized to a person's unique hearing loss pattern, as they are simply electronic devices originally designed for people with normal ability to hear and not to amplify sounds for recreational purposes. These devices are not meant to be worn all the time. Okay, so but we need to be mindful that the profile of hearing loss is not the same for everyone. So simply making everything louder doesn't necessarily make speech clearer. So probably let us compare the difference between hearing aids and amplifiers using an illustration. The vertical scale that you see on the chart represents the loudness, while the horizontal scale represents the pitches. And moving down the vertical scales, it represents the loudness required to elicit the response from an individual. You will see the points goes down as the hearing levels worsens. And in this case, this individual has different hearing levels at different pitches. So let's see how the amplifier works differently from hearing aid with the animation. We see that the amplifier will amplify sound equally at all frequencies. Okay, and if the individual puts it on at a comfortable level, as represented by the lower dashed line, they may perceive everything to be louder, but they may still miss out some higher pitch sounds. This means that the speech may not be actually clear. However, if they continue to increase the volume so that they could better pick up the higher pitch sounds as represented by the top dashed line, they may actually find it very uncomfortable as they are picking up too much low pitch sounds now. So this can also lead to damage in the better regions of the inner ear with prolonged exposure. Hearing aids, on the contrary, resolve this dilemma by amplifying sounds differently at different pitches. So that the user can actually hear clearly without putting themselves at unsafe level. So what I want to convey is that the bottom line is that hearing amplifiers are affordable and may help in mild cases, but you're actually left on your own to figure out if your amplifying sounds sufficiently and not damaging your hearing due to unnecessary amplification of sounds.
So thank you for clarifying that weighting. So I guess that's really why it's important to, it's not about the device. It's also the getting advice from your healthcare professional so they can tailor fit the device to your hearing. I'm sure our audience are also thinking that hearing aids are not cheap. So would like to know, is there subsidy available for us?
Yep. So if individuals are keen to get hearing aids, for hearing aids, there are two subsidies option available. The first subsidy option is known as the Seniors Mobility and Enabling Fund, administered by the Agency of Integrated Care. This is a one-off subsidy applicable for Singapore citizens aged 60 years and above, and with at least a mild hearing loss in 1 year. So for this subsidy, household means testing will be required and can be done at the AIC office in the hospitals itself or by mailing the household means test application form to AIC. So generally, individuals with the Blue Trust card should be eligible for the subsidy. But for those with the Orange Trust card, subsidy may depend on the annual value of residence. So moving on to the next slide, individuals eligible for Senior Mobility Fund can have up to 90% subsidy on their hearing devices, but capped at $2,700. For example, if a pair of hearing aid costs $3,000, 90% subsidy amounts to $2,700. As such, you pay $300 for a pair of hearing aids. However, if the hearing aid costs $5,000, 90% subsidy amounts to $4,500. However, maximum subsidy is $2,700. So in this case, you pay $2,300 for a pair of hearing aids. So another subsidy option is the Assistive Technology Fund. This subsidy is administered by SG Enable and is applicable to Singapore citizens or permanent residents of any age. So for individuals less than 60 years old and they are not eligible for the SMF subsidy that I mentioned earlier, they may tap on this subsidy, the ATF subsidy. Likewise, household means testing will be required and assessment by the medical social worker is required to determine the subsidy amount. So this subsidy has a lifetime cap of 40K and can be used to purchase new hearing device or consumables and even hearing device repairs. Yeah, maybe Dr. Jiayin can share more about the subsidies for implantable devices.
Yeah, sure. So the Ministry of Health recognizes that cochlear implants are the only solution currently we have for severe to profound hearing loss patients. So they are aware of that and they do provide some degree of funding. The ACE, which is the Agency for Care Effectiveness, offers funding for bilateral cochlear implants in children. But for adults, they only offer funding subsidy for one cochlear implant for Singapore citizens. There's no age limit for this, and like anything in Singapore requires evaluation by household means testing. The subsidies only apply to the standard package of cochlear implant devices as approved and listed out by ACE. So for more information, you can actually look at the website listed there. Do bear in mind that cochlear implants are meant to last a lifetime. So they actually can, the most of the implant companies will tell you it's meant to last a lifetime of about 75 years. That's why we implant children very young and it's supposed to last them till the end of life.
Okay. Thank you very much, team, for explaining and sharing your expertise with us. It's really good to hear that, actually getting your hearing checked is quite simple and you can do it all in one day. And then it's good that funding is available in Singapore. So it shouldn't actually deter, our audience from seeking treatment. The important thing is that they taking the first step to get their hearing checked. Now, let's open the floor to our questions from our audience. So I'm sure many of them are really curious to find out the answers to your from you. We have this from Queenie. If gradual hearing loss due to work hazard, yeah, example, marine engineer, as need to to be under loud noises, will the hearing recover gradually when we refrain from contributing factors?
Yep. Okay. Maybe I can take this question. Yep. So I think it's really good to hear that from Queenie that she's actually taking steps to protect her hearing by wearing earplugs. So I think we need to understand that for most noise-induced hearing loss, it's actually caused by the damage and eventual death of the hair cells in our inner ear. So unlike birds or amphibians, our hair cells, human hair cells don't grow back. So if you do not protect them, they are actually gone for good. So when you're exposed to loud noise over a long period of time without wearing hearing protection, you may slowly start to lose your hearing because the damage from noise exposure is usually gradual and you might not notice it or might even maybe you're just unaware about the signs of hearing loss until they become more pronounced. So over time, sounds may become distorted or muffled, and you start to find it difficult to understand others when they are when they talk, or you have to even turn up the television very loudly. So damage from noise-induced hearing loss combined with aging can lead to hearing loss severe enough that can hinder your daily activities, and you will need hearing devices to magnify the sound around you to help you hear and communicate better. But the good thing is that this form of hearing loss, noise-induced hearing loss, is actually completely preventable. Yep. So by wearing earplugs or other protective devices when you are involved in the loud activity can actually help to protect your ear. If you can't reduce the noise or protect yourself from it, it's important to move away from this loud noise source. I guess also the rule of thumb is that you need to know how loud you are hearing as well, because noise-induced hearing loss will actually sits in when you're exposed to too loud a sound for a long period of time.
Okay, thanks for sharing, Charmaine. I hope that answers Queenie's question that prevention is always better than cure. So next is a question from Stephanie. There are some elderly around me who is experiencing hearing loss, but they feel embarrassed to go and get checked and wear hearing aids. How do I persuade these people to go?
Okay, I'll take this one then. It really depends on the patient. I know it's like trying to pull a horse to the water to drink water, but it just won't go, right? Maybe you can actually enable the help of your family members to say that everyone individually comes up to say, hey, how come you can't hear? Or maybe the grandchildren says, how come you can't hear? And then over time you just tell your elderly mom and say, there are a lot of people have noticed you can't hear. Maybe let's have it checked out. Maybe it's just earwax, and that can be treated. So there is a push factor to say that everyone notices there's a problem. So maybe you should realize that it can't just be one person complaining you can't hear. There are a lot of people have told you can't hear. So maybe let's have it checked. And to make it not so scary or not so confronting to go to a doctor, just say that, maybe it's a remediable cause. Something can be done and you can get better. So let's go have it checked out. And then, of course, once you come to the ENT doctors, we'll have a look. And maybe really, sometimes it can just be earwax or say a hole in the eardrum causing hearing loss. And then we do a proper hearing assessment. Okay, having said that, not everybody's hearing loss is the degree which needs a hearing aid, but only a comprehensive assessment will tell. If you can't even make the first step to step into an ENT clinic, you are not going to get anywhere. So, that is one tip I would say. And Hui Ting and Charmaine, if you have any ideas, please let Stephanie know.
I think these are useful tips. So thanks for sharing how we can persuade our family members or friends. I have another question from Dave. Does cancer treatment like RT related hearing loss cause dementia?
Okay, radiotherapy per se is actually, I think you probably radiotherapy to the head and neck region, because radiotherapy in other areas of your body don't really affect hearing loss. So now, radiotherapy in the head and neck region, if it's to the most commonest head and neck cancer in Singapore, which is nasopharyngeal cancer, nose cancer, do be rest assured that when you have treatment, the radiotherapist or the radiation oncologist maps it carefully so that it does not affect your brain. Okay, so it does have some collateral damage to, say, the cochlea, but it doesn't. It stays away from the brain, and it's intentionally so because we don't want you to suffer any side effects of radiotherapy to the brain. So radiotherapy doesn't cause dementia, but like I want to just maybe explain go back to my three slides, and maybe I will also take. I saw a very good question from Rano about whether people with hearing loss already have they have dementia. Can I trouble the admin to show me the slide about how hearing loss causes dementia?
Okay, so I think the slide will be put up just about now.
I'll continue then. Okay, so if you already, so how this research actually was done, and it is still ongoing because there are a lot of answers which are not answered, and a lot of more questions than answers actually, is that they took a whole group of, a large group of elderly patients who had dementia. Then they looked back into the, what are some of the things which they found identical in these patients with dementia, and they found that hearing loss was one of these things. Then they stratified the hearing loss into mild, moderate, and severe, and then they did the statistics, and they came out with what I told you, whether you have mild hearing loss and moderate or severe, and its risk to dementia. Now, these are untreated hearing loss. So if you look at how the hearing loss causes dementia, it's in three things: brain atrophy, brain overload, and social isolation. So we are hoping that if you identify your hearing loss early and you actually do something to address it, brain atrophy, we hope, does not happen, because once you hear, the hearing portion of your brain keeps getting stimulated. And as a result, it doesn't create structural changes with other parts of your brain, because obviously hearing loss would trigger other structural changes. If it is remedied early, hearing loss is remedied early, you won't get the brain atrophy. Secondly, if you correct your hearing, will it cause brain overload? No, because you actually don't strain so much to hear anymore, so that preserves some degree of mental function for other higher executive functions of your brain. And lastly, of course, I think I can't stress this more, just buying a pair of hearing aids wouldn't prevent you from having dementia. If you wear a pair of hearing aids and sit in isolation and silence the whole day, it's not going to help you. You got to go out and enjoy life. This is the point of us having lived we are now in the 21st century. We need to live well. And I think everyone's talking about quality of life. We want to enjoy our lives. So hearing well is the first stage. And you want to go out and interact with your friends, your families, and keep active. Yeah, so that if you correct your hearing loss, you keep active with your social network, you won't get social isolation. So treating hearing loss early overcomes these three things and retards the onset of dementia, if any at all.
Yeah, very well said, Dr. Chiang. Yeah, I think that has a link to this next question from Ranald. Yeah, hearing loss increases the tendency of developing dementia. How about those who are deaf? Do they develop dementia faster?
I think I answered that just now, because I think it kind of tied in together. So I hope that answers Ranald and Dave's question as well.
Okay, good. Let's see if we have other questions. From Dave. Do these cochlear implants last forever?
Not eternity, but long enough. I think 70 over years is good enough.
Okay. Another one from Mona. Can cochlear implants help with profound hearing loss from birth? Yeah.
So that question is very interesting, because right now in Singapore, we have, if you're talking about hearing loss from birth, a lot of our babies are actually picked up on a hearing screening, so they should have been picked up early, and they would have been rectified early. Because if you think about it, I don't know where Mona is from. It's in Singapore. Basically, we pick them up early because we need to keep them in the communicating world. If you think about it, if you don't correct a profound hearing loss patient, what does it mean? The child would then go on to become a sign languager, which then has impact on education. They can't go to normal school. They go to special school. And it makes things difficult for tertiary education, which I'll tell you a story later about a patient who has this problem and going to university. And it also makes it difficult to go out into the workforce. Yeah, they might work as a special education teacher teaching sign language in, say, a school, but is this the job you want for your child growing up? You want them to have a lot of more opportunities than just, the world's their oyster. You want them to be international citizens. And you can't do that if you're a sign languager. You want to have the medium of communication to go out into the international world. Now, drawing on on a story of my patient, I had a patient who came to see me. She was severe to profound hearing loss since birth, and she was not picked up because she was not born in Singapore. So eventually, she was a lip reader. She needs many modes of communication: lip reading, sign language. She had some degree of environmental awareness with hearing aids, which obviously didn't quite work because the hearing loss degree was too severe. But she's a smart girl. She's a smart, pretty girl. And she did well in studies because she went to special school. And now she wants to do architecture. That is the problem now, because now she wants to go to university. And the university may not be so well equipped with a lecturer who can sign language to her. There are problems with wearing masks nowadays because it's COVID, and obviously face shields now we know may not be the best thing, even if it doesn't offer much protection. So she faces a lot of uphill tasks in terms of communicating just to learn. And I cannot imagine when she starts work, the challenges would be even more. And she's only 20 plus.
Okay. I hope that answers Mona's questions. Another one we have from Stephanie. Yeah, a lot of people nowadays are plugging earphones to listen to music. How bad is it to the ears, and will it gradually lead to hearing loss?
Shamina, waiting you do this one.
Yeah.
I think you do this a lot.
Okay, I'll take this one. So on this case, yeah, we do see many people wearing earpiece, including me, in their daily commute to work or anything. So, but what is most important is that whether is it headphone or is it earphones or is it speaker, it doesn't matter. What matters is there are two parts. What it matters firstly is the loudness and the duration exposure to the music that you're hearing. And the rule of thumb is that if your volume is set at 85 decibel, then you should keep your exposure time to within 8 hours or less. And this is excluding your other exposure to noise in daily life. And one important, and actually the louder you go, then the duration that you should be listening to this music should be kept shorter.
So waiting, maybe can I clarify? If I can hear what music the person beside me on the train is listening to, does that mean that's too loud?
Probably it's too loud.
So I shouldn't be able to, I should still be able to listen to people talking even when I'm listening to music. Is that correct?
Yeah, and one more thing is that, let's say if you're talking to this person on his earpiece and he or she cannot hear you, probably they are also listening at a too loud volume.
I see. I have another question from Venkat Krishna. With such high risk to active aging due to hearing loss, are there steps being taken to make hearing checkup part of the annual health checkup from early on? Is it becoming a standard?
As you know, annual health checkups, they're actually determined by a health screening company. So they just put a package together, and that's what it is. There's no guidelines per se or essential things which must be put into a health checkup. So I think if you are keen to get your hearing checked, that's always possible. You just tell your GP. There are some groups of patients with high-risk occupations who would definitely get a hearing test done every year. But you know what? You don't really need one every year. You can have one for baseline. If you have normal hearing, you don't need to have one done yearly.
Okay. Yeah, we have a question from Amy. Yeah, again, if we suspect a family member having hearing loss, what's the first step to take? Do they go GP? Do they go poly? I think a while ago in the diagram, maybe you can refresh.
Yeah, maybe I'll take this question. So probably you can flash out the slides.
To remind everyone, yeah.
Yeah, to remind everyone, yes.
So if we can pop up the slide on there was a referral flow or where to go.
Yeah.
Okay. Yes, this one.
Yeah. So okay, so whether you go to the GP or whether you go to the polyclinic, I mean, whichever you go first, like, doesn't matter. But if you are quite certain that you probably need financial assistance or things like that, then probably you make sure that you go to the GP Charles registered GP clinic or polyclinic. Yes, because yes. So what the route is that just always make sure that whether the patient actually your next of kin, your loved one actually has any other condition like ear discharge or they have ear pain or dizziness associated with the hearing loss. Yeah, and then after that you go to the GP polyclinic, and then they will actually refer you to the ENT specialist for further medical assessment.
Okay. Hope that answers the question. Let's see if we have other questions. From Kathy. How do you carry out pure tone audiometry? I think this is the type of hearing test for those with dementia. What techniques or adjustments to do for the elderly to respond appropriately?
Yeah, maybe I can take this question. Yeah, so this is really very interesting. So for patients with dementia, I guess it really depends on how their response is like, because some patients with dementia are still able to follow simple instructions, and they're able to carry out the pure tone audiometry test pretty accurately, where they just have to listen to the sound and then press the button. However, we also do see in the clinic for some patients with more advanced dementia, they are unable to understand the pure tone audiometry instructions. For these patients, we actually do have objective testings where we do not require patients' subjective response. So some of the tests that we do have in the clinic will include autoacoustic emission test. For this particular test, basically we just put a probe inside the patient's ear, and what this equipment do is that the equipment actually measures the health of the hair cells in our inner ear, and it provides an estimate of the patient's hearing loss. Then another test that we do is also called the auditory brainstem response test. So for this test, we actually place electrodes on a few regions on the patient's head. What this test does is that it actually measures the electrical activity in the brain, and it also provides a very good estimate of a patient's hearing threshold without them having to respond to the very soft sounds.
Okay. So I guess good to know that there is a way to test such patients who may be showing signs of dementia if they cannot respond to the regular means. I think one last question from ID Tan. If a patient is presented with hearing loss and dementia, do you think hearing aid fitting is helpful?
Yeah, okay, maybe I can take this question. Maybe what we can do, let me see. Okay, so I think we have discussed about this earlier, is that while we know that for those like we understand that from the research that Lancet Commission said that 40% of dementia cases can be prevented or delayed by correcting hearing loss. But the thing about it is that when somebody is already medically diagnosed with dementia, there is still no concrete evidence to show that wearing hearing aids can treat dementia or slow down cognitive decline. But what we can say is that for patients with dementia, at least wearing hearing devices, what it does is that it actually helps them communicate better with their family members, at least lead a social, active lifestyle, having a good social lifestyle with their family members and their loved one, being able to communicate and be able to, be with the family members. This is what is important. But we wouldn't say that, wearing the hearing device alone will treat dementia. So like what we say again, our advice is that to treat hearing loss early and to reduce the risk of developing dementia. But it is important to put on the hearing device and use it regularly and communicate and be engaged in meaningful social activities to allow them to exercise cognitive skills like memory and language.
Can I just add on to what Shemaine has to say to respond to this question? Honestly, the research is still ongoing. The question is on everyone's minds, whether wearing a hearing aid will stop dementia, retard dementia. But we are all scientists and we want to say things with conviction. And these kind of studies take many years. As you know, dementia evolves over 5-10 years. So giving an intervention now, I can only give you the answer like 5 to 10 years time. And so the data collection is ongoing, but we don't have the conclusion as yet. If and when there is a definitive conclusion about treating hearing loss, whether intervening in hearing loss can retard dementia, I think it will be in the front page news. But the honest truth is that the studies are ongoing and the questions you raise are very valid. That's why it's really in the data collection and the observational phase. We don't have the answers now, but we might have it in about five years, maybe, for you.
Thank you, team, for answering all the questions, and thank you for, thanks to our audience for sending in all your questions. We're very happy that this is become an interactive session due to your questions for today. Now, before we end, I'd like to announce our lucky draw winner. So we actually randomly selected from our list of registrants, and I'm excited to announce our winner is Anna Cheng. So congratulations. We will get in touch with you on how you can collect your prize. So please note that those of you who are curious to get your hearing checked, you may also follow the link that you can see below to avail of your free online hearing screening. So all you need to get this hearing screening is some earphones, your headphones, which you can actually use with your smartphone, your laptop, or your tablet, and just do a quick 10-minute hearing screening. If the result suggests that you may have hearing loss, then you can then schedule a consult with our Ang Teng Fong team to have a complete diagnosis and advice on the appropriate treatment options. Okay. Now, before we close the session, let's hear again from Mr. Chu. 4 years down the road since he got his cochlear implant, I'm sure you're all curious on seeing how Mr. Chu is doing now and what his advice is to many of you out there. So let's play Mr. Chu's video.
1940年是不是81岁 ？IC 也是1940年12月6号，大概3年多有了。 我很少在家里的，我有组织一些年纪大的人一起去啊去玩。我现在还有组织一个月1-2次啊聚餐这样的。如果你没有带这个，听不到，我那听不到。好像超语言那叫超语言了。如果你没有带这个超语言了。那时候是还没有说很严重啊，后来严重了，连那个助听器都没有用了，越来越少了，越少，越来越哈哈哈哈，一直就听不太清楚了。医务人员叫我建议了，他问我要不要了，等我年纪长大了就试试看了，就开试试看了。我是怕有副作用还是什么，不我在做了，我还是没有什么副作用呢。因为这个不用电池的，所以插头就可以插了，所以不用整天拿电池这样，就省了些时间了，省了一些麻烦了。比较好一点啦，比较好一点的，所以我就知道我这样啊，我已经很满足了。看他的情况怎么样，我会给他意见。如果他他这个受到影响了，听不太清楚了。如果有这样的事啊，如果有帮助的话，有人做了之后，会对这个人有帮助啊，我就支持他做的。
Amazing video. So it's nice to see, Mr. Chu 4 years down the road in his hearing journey. So for the audience, as you can see, if Mr. Chu can do it, I'm sure you also can. So you just need to take the first step, seek consult from your hearing healthcare professional, and take that step to a better you. So to wrap up, I would just like to ask our Ang Teng Fong team, what would you like to say to our audience who are listening out there? Dr. Tsaying, I think you're on mute.
I do apologize. There are some key take-home messages, and they're very simple. That having good hearing is the first step to good communication with everyone, and is an important part of our life. And if you don't treat your hearing loss, they can actually affect your emotions, your family, and your social well-being. And of course, it can affect your cognitive status and affect you being socially isolated. So please don't be afraid. Take the first step. Tell your GP or polyclinic doctor you would like to have your hearing checked, and the rest will flow as it is. So not to worry, just take the first step. You will be fine.
Okay, so you've heard it from our Ang Teng Fong team. So thank you very much again for sharing your expertise with us. We hope you all found the session helpful. So we hope to see you again during our next live chat session. Goodbye and have a nice weekend.
Bye.
Bye.